All right, so we're still talking on chapter 14. So, some things that we need to consider when we're dealing with patients with infectious diseases is the presence of epidemic or a pandemic. So, an epidemic is when new cases of a disease in the human population substantially exceed what is expected. And this is within a region. A pandemic is a disease outbreak that occurs on a global scale. So, a flu pandemic occurs when the new influenza virus emerges and it spreads easily from person to person. It causes or can cause serious illness and then is found in multiple countries in a short amount of time. So, epidemic is one small region, pandemic is throughout the globe. Influenza is one thing that we run into quite a bit. Um, so the flu is an animal respiratory disease that has mutated in order to infect human. And what a lot of people call the flu is not truly the flu. A stomach bug is not the flu. But those who are more susceptible are those with chronic medical conditions, those that have compromised immune systems, very young and very old, are most susceptible to the flu as well as the complications that can arise with that. The flu is transmitted by direct contact with nasal secretions and aerolized droplets from coughing and sneezing. There's a couple different types of influenza. There's H1N1. This is what they initially called the swine flu, excuse me, has been present for years in animals and then was initially identified in humans in 2009. It's caused many deaths, but it has increased awareness of the routes of transmission. And so the effect that it's having seems to be dwindling. And then influenza A is kind of the new form that's um, hitting the media as a very hot topic right now. As far as for diseases that can be passed by a respiratory route, we definitely want to wear appropriate PPE. This can include gloves, eye protection, and a HEPA respirator. You're going to want to put a surgical mask on the patient as long as they're not short of breath to try and go ahead and contain the droplets from flying around. You want to wash your hands frequently, very, very, very frequently. If you have to suction, you want to make sure that you put your HEPA mask on for sure. Annual flu vaccinations are important for EMS personnel. It's not only to protect us, but it's also to protect our patients as well. Herpes simplex is a very common virus strain carried by humans. Most of the people, like 80% of them, are going to be asymptomatic. Symptomatic infections cause like little tiny fluid-filled blisters. They're actually called vesicles, and it appears on the lips or genitals. There's actually two different types of herpes simplex. One is genital, the other is your cold sore, common cold sore. This is typically not a huge issue. It's more inconvenient than anything else. However, it can lead to more severe illnesses like pneumonia and meningitis in patients that are very young, very old, or are immunocompromised. So what most people would just say, this is annoying, it can make people very, very sick. The primary mode of infection is through close personal contact. So just putting on some gloves typically is going to be good enough for us. We don't have to go above and beyond that most of the time. HIV infection, we definitely face a risk of exposure to the virus that causes AIDS on a regular basis. There's no vaccines. AIDS can still be fatal. However, they're coming out with some pretty spectacular medications that actually allow patients to live a near normal lifespan. HIV is only a potential hazard when it's deposited on the mucous membranes or directly into the bloodstream. It's not easily transmitted in the work setting. Our risk of infection is pretty limited. We have to come in contact with a fair amount of a patient's blood or body fluids. Just a single drop on your skin is not generally sufficient enough to actually cause transmission. Needle sticks are a little bit different. Those we want to be a lot more cognizant of, but just having close contact with somebody that has HIV or AIDS is not enough to get it. Many people that have human immunodeficiency virus, HIV, show no symptoms. So we just want to go ahead and put on some gloves, make sure that we are very careful in our handling and disposing of needles or other sharp objects, and cover any open wounds that we have while we're on the job. So if you have an open wound, our hands very frequently like to crack since we wash them so much. Definitely use some lotion after you wash so that your hands don't get too dried out and start cracking, because that's going to lead you more susceptible to contracting certain illnesses. But if you've got another one, just go ahead and put a Band-Aid or a Tegaderm. It's a clear dressing that we use on IVs. If you throw that over top of it just for the time that you're at work, that'll protect you much better than not covering it at all. If you think that the patient's blood or secretions may have entered your system, make sure that you notify your infection disease officer, your supervisor for that shift, and follow whatever your company's policies are. Typically, the first thing they're going to say is wash with soap and water. Hepatitis, this is inflammation of the liver. Sometimes you get an infection on top of it. There are several different viruses or toxins that can cause this. Early signs include loss of appetite, vomiting, fever, fatigue, sore throat, cough, muscle or joint pain that will end up leading several weeks later to jaundice and right upper quadrant pain. The toxin-induced hepatitis is not contagious. However, there's really no way to tell if they have toxin-induced or not. So just treat everybody as if they're contagious. Hepatitis A can only be transmitted from a patient who has an acute infection, whereas hepatitis B and C can be transmitted from long-term carriers who don't have any signs of illness at the time. So they can actually be a carrier. So a carrier is a person or an animal who has an infectious organism that has basically taken up permanent residence, and they may not have an active form of the disease. Hepatitis A is transmitted orally through either oral or fecal contamination. Hepatitis B, just fun fact, is far more contagious than HIV. So for us to protect ourselves, we typically have to get a hepatitis B vaccine. Most of our employers are not going to let that pass. Either you're going to have to get the series, or you're going to have what's called a titer drawn to see how many antibodies you have in your body that can fight that infection if you were to be exposed to it. Meningitis is the next communicable disease that we can come in contact with. This is inflammation of the meninges that cover the brain. There's a couple different tissues that cover over top of the brain, and this is when those get inflamed. Signs and symptoms include fever, headache, stiff neck, and then an altered mental status. Most forms of meningitis are not contagious. However, there is one form, the meningococcal meningitis, which is highly contagious. We need to take standard precautions. Gloves and a mask will go a long way to prevent a patient's secretions from getting into your nose and mouth. You may end up getting vaccinated for meningitis as well. Meningitis is going to be treated in the ED with antibiotics. It's typically not going to have a high mortality rate, unfortunately. If you have a patient that has meningitis, contact your health employer representative so that you can verify that there's nothing that you need to do to protect yourself. Tuberculosis. Many of our patients that have tuberculosis are well a good portion of the time, but they can have a chronic mycobacterial disease that strikes the lungs. You can have the disease involving the brain or kidneys as well, but the patient is less contagious when it affects somewhere other than the lungs. So the disease occurs shortly after infection. It's called the primary tuberculosis. Reactive tuberculosis is common, and it can be much more difficult to treat, especially because an increasing number of tuberculosis strains have grown resistance to most of our antibiotics. So there are some that it sticks around in your body forever, and then all of a sudden decides to react to what's going on in your body. The patient who actually poses the highest risk almost always has a cough. Consider respiratory tuberculosis to be the only contagious form because it's the only one that can spread by respiratory transmission. You want to use an N95 or a HEPA mask to stop those droplet nuclei. Droplet nuclei are the remnants of the droplets that are produced by coughing or after the excess water has evaporated. So those droplets can actually hang in the air for quite some time. Infectious agents can take hold in some patients more easily because they have reduced defenses or a compromised immune system. So those are elderly patients and those who are immunosuppressed from either chronic illnesses, cancer treatment, or organ transplants where they have to be immunosuppressed all the time. Absolute protection from an infection with the bacterium that causes tuberculosis, so tuberculobacillus, doesn't exist. According to the CDC, about 1/3 of the world's population is infected with tuberculosis. There is a vaccine, but we don't use it a whole lot here in the US because the mechanism of transmission is not very efficient. So we generally have lower instances of tuberculosis than some other places in the world. We do TB tests regularly. If the infection is found before you actually become ill with it, then preventative therapy is almost 100% effective. So this isn't something that we worry about, certainly like we used to. Whooping cough, this is also called pertussis. This is an airborne disease caused by bacteria and mostly affects children younger than 6. Symptoms include a fever and a whoop sound that occurs when inhaling after a coughing attack, and they cough and cough and cough and cough and cough and have a really hard time trying to get air in. That's where that whooping sound comes in, because they cough so much that they literally are gasping for breath, and that's pretty scary. The best way to prevent exposure is to be vaccinated. So your DPT or Tdap vaccine is certainly something you want to keep up to date. And then you want to place a mask on the patient and yourself. If the patient is short of breath, you may want to be very cautious about putting a mask on them because that can make their symptoms worse.